Welcome, everybody, to the OPT Network. This morning, we're joining our community partners, Christus Cabrini Hospital, and we are happy to welcome, for the very first time, the newest addition to Christus Cabrini Hospital, and that is their new president, Mr. Monte Wilson, here to talk about all of the things that are happening at the hospital and their community partnership with the city of Alexandria and Pineville when it comes to vaccinating our community for the COVID-19 virus. Monte, good morning and welcome.
Good morning, Carlette. How are you doing today?
I'm grateful, and I know a lot of people have heard that there's a new president at St. Francis Cabrini Hospital, but let's talk about you coming into that position. Tell people a little bit about your background.
So I have over 20 years of experience. I come from a history of working in Catholic healthcare. My recent move was from Atlanta, Georgia. I worked for the Wellstar Health System there, where I was one of the regional presidents there for a hospital there. And I originally from Fort Smith, Arkansas, where I was born and raised. Attended the University of Arkansas, got my undergraduate there in business management. Also came back and went into the College of Engineering, where I got my master's degree, operational management. So a different twist than your typical process of manager healthcare, master's in healthcare administration.
So how do you get from engineering to healthcare? How does that happen?
Well, there's different parts of engineering, and some of the things that is most important is this operational, process, critical pathways and things of that sort. And in healthcare, that's pretty much what it is, following guidelines, protocols, policies, and being very effective and very efficient to get the outcome that you're looking for as it relates to patient care. So that was my way of saying, hey, I need a little bit more understanding of that, how that works with Six Sigma and things of that sort.
Sure. And so we welcome you to Louisiana and already hearing really great things about what you were doing. Talk about the things that coming into a new healthcare system in the midst of COVID-19, what your goals are for the hospital.
So coming in and arriving, they had done a very good job in the sense of managing COVID patients and being able to ensure that they were receiving the best healthcare they possibly could get for that disease type. What I wanted to do was to make sure that we were continuing as we learned more about COVID and the effects as it has on individuals who would get COVID or the prevention of COVID, and how do we protect our staff and how do we protect our visitors, and how do we offer the best care for patients. So that continuum of understanding as disease was really a good understanding from the CDC and what we needed to do and not do, and continue to improve upon that, whereas giving access to more family members is where we're at today. But it started off with nobody could visit, but now we're up to where we can get at least 2 people to visit their loved ones, because it really is important to have that family member there for the support of the healing process with their loved one. And so my whole idea was trying to take what was out there, make it better, try to improve, educate the community regarding COVID and our staff and our physician staff, medical staff, to make sure that we're all moving in the same direction and that we're communicating well.
And so in the midst of COVID-19, your healthcare workers and everybody in the hospital has been just overwhelmed with work and the patients. How do you bring them all together to give them the energy and the lift that they need to continue to do the work?
We continue to focus on different methodologies. You can buy lunch, dinner, breakfast, whatever it may be, to encourage them. But I think one of the things that we have done that's really it's been beneficial is that spiritual well-being, the resiliency, where they can actually have a connection to learn how to understand the condition that they're in, avoid the burnout, but get some sort of meditation in their life to where they can stop and think and see where they're at and try to rebuild and refocus. But we do a lot of things in that aspect. We're really working to get them time off, because as many of the healthcare workers have just been working and taking extra shifts. Well, you can only do that so long. So we really are striving to try to get them more PTO where we can to start that process. So those are some of the things that we've been doing, and just listening and letting them be able to talk and tell us what's going on in their particular work environment.
Mm-hmm. And so when the vaccines first dropped, Christus was one of the first hospitals really in the country to get the vaccine. Talk about how big that is and was at that moment.
Well, for us, that was huge because, we had the capability for the Pfizer, the refrigeration requirements, the sub-zero temperatures. We were prepared for that. So that gives our community much assurance that we have the technology to be able to handle any type of, vaccines or anything that would come in the future. We have that innovation and technology to be able to, take care of those medications until they can be delivered. But it's not just that, it's across the board in other areas that we really focus on. Like, for example, the monoclonal vaccine. We delivered, we gave over, I think, close to 1,000, where many systems were not doing that. So we believe that saves many, many lives from COVID. So those type of things, being innovative, accepting that technology, I think gave the state and the federal government the assurance that the vaccine would be distributed appropriately and it would be sent out in the best way possible, in the most effective way, through logistics.
And so as you are new to the system, how do you get everybody on board with what the goals are that you have in mind to grow and to get better?
Number one, you got to understand your mission. I mean, that is the foundation. What are you striving for? Set a very clear vision of where we're going and execute. I think everyone understands that we can always talk about what we're going to do. At the end of the day, you have to execute. And so my message to our team is, let's understand what we're trying to achieve and where we're going, and set target dates of when we're going to, continue to hit those milestones to get us to where we want to be. Some things takes a little longer. Some things happen very quickly. But at the end of the day, it's communication, execution, and accountability. Some of the basic things in leadership is just executing it and making sure you stay on top of it. And the other thing I do is a lot of rounding. So I'm out and about and really trying to learn everybody's name as I possibly can. It's a challenge to remember, close to 2,000 associates' names, but, really being there and encouraging our executive leadership team to be out also rounding.
Absolutely. Let's take a break here. But when we come back, Monte, I want to talk about the prayer vigil, and I want to talk about going forward, the partnership that you have with the city of Alexandria and Pineville, and what that will look like to people who need and want to get vaccinated. Our guest this morning is the president of Christus St. Francis Cabrini Health System, Mr. Monte Wilson. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. It is our great pleasure to have here on the OPT Network for the very first time the new president of Christus St. Francis Cabrini Health Systems, Mr. Monte Wilson. And he joins us to talk about how Cabrini is being the change that they want to see in our community. And before we went to break, we were talking about leadership and mission and the vision that the hospital has. And I know that extending the healing ministry of Jesus Christ is out front. And you guys had a prayer vigil earlier this week. Talk about how that came about and why it was so important.
Thank you. So for me, if our mission is to extend the healing ministry of Jesus Christ, then we have to make sure that is the foundation of which we're going to do everything, operationally, business, all your ethics, integrity, everything that comes just in that, good medicine, excellence, all those things is wrapped up in that one mission statement. And so for me, we needed to make sure that we started off with that understanding. So what I wanted us to do was to be able to bring our pastoral leadership and come up with the idea that we should have a visual, not only for our leadership and for our team members, associates and medical staff and physicians and clinical workers, to show that there is a much higher calling in the sense of what we do every day. So how do we do that? And first, you start off with understanding that mission. So they agreed to where we would have this visual to where we would invite all of the community faith leaders to come on site and be able to pray for, our team, for those who have lost loved ones during COVID, those who are still battling the effects of COVID, and making sure that everybody had this opportunity to kind of take a moment and meditate and ask for the strength to continue on and refresh our souls, in a sense, as it would be in the healing ministry of Jesus Christ. And so that took place. It was outstanding. In a sense, it was a great evening for our staff here and for our community. So it went well, went very, very well.
Mm-hmm. And so were you able to get any feedback from team members about what that felt like, that they would be embraced and prayed for by so many people?
Yes, we did. We received several comments from our staff associates where they were expressed their gratitude and thankfulness that the leaders of the community would come and take the time out of their schedules to spend time on this campus to extend a prayer for them on their behalf. They were very appreciative of that. And
so moving forward, I know that nobody's working harder than Christus to get people vaccinated. And so you guys have created a community outreach COVID vaccine clinics that will open in Pineville and Alexandria, also in conjunction with Rapides Hospital. Talk a little bit about what that will look and feel like.
So we have started the process. I had met with Mayor Hall and Mayor Fields. And my idea is that somehow we needed to partner, which they agreed to. I didn't think that they would not want to do it, but they're just great leaders. How can we extend the vaccines to the community? Because the approach and the way we have been doing it is that we've been setting up clinics and telling people to come to us. I said, we really need to rethink that. If we're trying to get to those communities that perhaps don't have internet, perhaps don't have transportation, we need to go to where they can at least walk up and have access to the vaccine. And we did that. And we have started on Tuesdays. We're alternating Tuesdays. One Tuesday at the Bolton Community Center in Alexandria, and then the other one is the Pineville Community Center. And we're every other Tuesday. And I've had great success. We've had a lot of people walk up as expected. That it met our goal. That there was this big need of people not able to have access because of those things I just said, or even the education piece of it.
So when they walk up, because there's been this whole idea that you'd have to go online and you'd have to get yourself registered online and get an appointment. So with the walk-up approach, anybody can just walk up to the clinic and be vaccinated? Is that how that's going to work?
Exactly. And for that very reason, we want you, if you have the capability to go online and register, because it'll make things work a lot smoother, and get an appointment so that we can make sure that we have the right doses there, because we don't want to waste it. So therefore, if we know the appointments, we can make sure we have the vaccines readily available. But also we understood too that some people didn't have the access to be able to register. So therefore they could walk up. And we've had probably over 50% of them every day so far have been walk-ups.
And for those people at those community centers, what has been the response? Because we know, especially in the communities of color, that there had been a little bit of apprehension about whether or not to vaccinate. What is that looking like now?
I think it's starting to resonate with the communities. I mean, between us and Rapides, Cabrini and Rapides, and we've had staff from both hospitals there to try to educate and let the individuals know, the benefits or the risk and things of that sort, and walking them through it and answering any questions that they may have. And it's been very refreshing for them. And they've been very appreciative because, they have questions and they want answers. And we have been able to provide that for them. And they have responded very well to it.
Sure. And so before we've got to let you go, now that we're kind of seeing a little bit of lift from the virus, talk about the safety of the hospital for people who don't have COVID that need to come to the hospital. Talk about how they can feel safe doing that.
Yes. I would say the hospitals are they're the safest place for those who are worried about COVID. We have so many steps and so many processes to ensure the safety of our visitors and our patients. And I would just urge everyone who need health care that you've been putting it off for the fear of coming to the hospital, that you may get COVID. Put that aside because that's not true. This is one of the safest places you could come. So get your health care, go to your physicians because they have protocols put in place. Because if you prolong your need to go to the doctor for whatever medical condition you have, it's only going to make your health worse. So feel very comfortable that we've done everything possible to ensure the safety of your well-being.
There you go. So every other Tuesday, vaccinations are going to happen at the community centers in Alexandria and Pineville.
Yes, that is correct.
And all people have to do is just walk up. They don't have to worry about insurance. They don't have to worry about anything. Just walk up and say, I want to get the vaccine.
Exactly. We prefer you register if you can, if you have access to, for the organizational purpose.
Mm-hmm.
But if you don't, you just need to walk up. That's the whole purpose, is to have access.
Do we have a goal, Monte, as to how many people we hope to vaccinate?
My personal goal is that right now we have over 1,000 Pfizer vaccines that we can give out. My goal would at least give out 1,000, and let's just keep going. We can get the vaccine. It's just that we just need the people to want to receive the vaccination. Right now, 1,000, and we've done very well so far.
There you go. Monte, thank you so much for taking the time. May God bless the work of your hands. We also want to thank Chris Karam, who is an integral leader and has been leading the way, and you all are doing an amazing job in the community, educating the community, and for that we thank you.
Thank you for having me.
Indeed. Our guest this morning, Mr. Monte Wilson, he's the president of Christus St. Francis Cabrini Health System. Stay on point. We're back right after this.